of these leadership, sometimes I really get worried, that when are they going to get the help of such strong leaders we have, in nursing profession? Or maybe, we push ourselves forward. I have seen, if we don't push ourselves, people don't want us, So we need to push ourselves forward and make them realize that some of us, we are there, So that's important.
Very
Okay.
important.
Good
Hello,
advice.
Bimla ji. Good morning. Good
Hello,
morning,
Aisha.
everyone.
When are you coming back, dear?
I'm
No,
coming in December.
Oh, December. That's very far.
Yeah. Ah, 1.5 month more.
1.5 months more. Okay,
Yeah.
great. Uh,
Good evening, Dr. Khanna.
Good evening, Ji. And I said, leave my lady here, leader. We have an induction on 24th of November.
Yeah. We are getting ready for that.
Thank you.
Shall we start?
Wonderful, wonderful.
I said, do we start, Dr. Khanna, with you?
Yes.
Dr. Muttu?
Bimla ma'am,
Shall we
yes,
start?
ma'am.
If you give permission, we can start.
Hi, Anu.
Oh.
How are you doing?
Yes,
Good
ma'am.
to
Good
see you.
morning.
Good to see
Hope
you
you all
again.
are doing good.
आपको पार्किंग
yes.
लॉट में भेजो तो वो हमें ऑन करें.
Yes,
Yeah.
ma'am.
Tinu sir.
Where is
I
our...
would like to inform everyone that my Instagram account is hacked today. So you might get some of the messages and all. So that's not me.
Okay, thank you.
Uh,
Where is our young president?
I
Sure,
think
ma'am.
Oh, he's in the car.
yeah, he's visible now in the moving car.
Going to church,
actually,
ma'am, morning.
You are also there in the car?
Yes, ma'am. Yes,
Maybe
ma'am.
it is you go to church or what?
Church, we are going, ma'am.
Okay,
On
you're
the
going
way.
to- Okay.
Ma'am, shall we start, ma'am?
I'm Swati ji. Start.
Khanna ma'am, shall we start, ma'am?
Hanji, please do.
Swati ma'am, we can start.
Hello. Shall we start?
Yes, madam, please.
So very good morning
Good
to
morning, all dignitaries.
Good morning, all.
Pratibha Chandekar here.
Good morning to all. Welcome you today in the NSS webinar series 9 2024 and research study presentation, that is series 9. Welcome you all and glad to see the great experts in the team today, and it gives me immense pleasure to welcome you all to this special event, and we are truly honored by your presence today, and we are thrilled to have you share this momentous occasion with us. As an anchor, I feel honored to be this part of this event, and I would like to welcome our main we can say the founder and the patron of this event, Dr. Narula Khanna ma'am and Binu Josa. This is my, as I say always, that this is my profile, that I have experience and many experts and forensics and authorship. Next slide, sir. Okay. So next slide, sir.
Yes,
so
madam.
first of all, I would like to introduction of our today's great leader of this expert or this session, that is founder of this session, that is introduction of our patron ma'am. She has a 45 years of professional experience in a variety of settings such as administrative management, and published extensively in referred journal and authored of a historical in the nursing. And Indian nursing leaders are from 1947 to 2000. It's a great time. And the third edition in the print. Madam has been a TNI branch president for the 10 years in USA, Canada, and was a national representative of a TNI at the United Nations and NGO conferences. Madam has the patron of these 4 prestigious nurses societies in India, CNRS, NHS, and NTI. Madam worked as a director of nursing in the Gwalior Sophia Nursing College, JNC, and Mahatma Gandhi University. Madam works as a freelance consultant of curriculum development of nursing college, and Madam gives her message. So we would like to welcome Ma'am, and please give message to this session and today's event.
Thank you for your glowing introduction, Swati ji. Always, I'm honored. Anyway, respected dignitaries, chief guest of honor. There are two, and one is also a resource person. Special guest, our Iron Lady and Dr. Asha ji, our SNT president, and our founding president, Dr. Binu sir, executive team, chapter presidents, organizing team, and our keynote speaker, evergreen sister Meena Petolji, and our two research presenters, Suresh sir and Pratibha ji. So it is always a great pleasure to witness our executives who enthusiastically are so ready to share with us their hard-earned research degree, its findings and implications, which can be utilized in given to our assigned patients. I'm sure RNS and especially students will soak the knowledge like a sponge and get benefited. Best wishes and God's blessings for successful presentations. I will join you all later to announce the list of all new members for induction in our society. On to you, MCG.
Yes,
Thank you.
ma'am. Thank you, ma'am. Thank you for a lovely message. So, life is the flower for which life is a honey. If you tend to a flower, it will bloom to a matter how many weeds surround it. So now I would like to welcome introduction of our Binu Joy sir, our president of National Nursing Scholar Society founder. Professor Dr. Binu Joy is a gold medalist and currently working as a principal in Rajkot, and he is having years of experience in the active involved in enhancing our NSS mission. He has conducted many national and international workshops, had been key proponent of recent international conferences and collaborations with Vibrant College of Nursing in Surat. He has published many research articles in referred journal and authored as a textbook nursing. Sir is a lifetime member in the many prestigious professional societies on editorial board and nursing journals. He is the pillar of our NSS society, and I would like to invite Binu Joy sir to give his valuable message. Yes, sir. Binu Joy sir.
Yes, ma'am. Thank you, ma'am, Swati ma'am. A very warm good morning to one and all, respected dignitaries, Dr. Pimla Kapoor ma'am, Dr. A. Qureshi ma'am, Patter ma'am, Suresh Khanna ma'am, Muthu sir, and all the research presenters. It's very energetic day as we start this winter season and festival seasons. First of all, a warm greetings of Diwali. And also, it's a Gujarat New Year after Diwali. So, Happy New Year for all of you from Gujarat side also. Yes, and I'm very enlightened and very eager to hear the from the research scholars their findings and their yes, it will be really beneficial for all of us to utilize their findings in further enhancing the scholarly activities. So, looking forward to hear from you all legends. Thank you and have a great day. Thank you.
Thank you, sir. Thank you. Flowers always make up people better, happier, and more helpful. They are sunshine, food, and medicine to the minds. Every flower is a soul blossoming in the nature. So, with this, I would like to invite all dignitaries and experts to come for the digital lamp lightning. So we can start.
Virtually, okay.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
Wonderful.
So thank you, sir. Thank you for this wonderful lamp lighting. So I will start with the today's session, starting with the honorable chief guest today and special guest. So honorable guest, chief guest today is Dr. Professor of PGI Chandigarh, India, and I would like to welcome ma'am. Then I would like to welcome our today's guest of honor, Professor Dr. Anu Joykutti, Treasurer NSS, and Professor Dr. Rita Lakhani, Co-Chairperson of Research Committee, National NSS. I would like to welcome you, ma'am. Then I would like to welcome today's special guest, that is Professor Dr. Bimla Kapoor, Man, Senior Advisors and National NSS, and Professor Dr. Ashia Qureshi, SNT President, National NSS, for this session. Your special presence and your time giving is we are very thankful to you, ma'am, that you are on the stage today. Then research presenters today are Pratibha Professor Dr. Pratibha Chandekar, Professor cum Principal with Vitthal Rao Vikhe Patil, Foundations and College of Nursing. She is going to present today a research presentation, PhD, and Professor Dr. Suresh Rathiram, that Ruhi College of Nursing Principal, Bangalore. I would like to welcome both presenters and give a best wishes to them for their proceedings towards the PhD presenter, and would like to have this honor to have your
Swati ma'am. Swati ma'am.
Seems to be some connectivity issue.
Yes, ma'am. Now I'll start. Swati ma'am, you are there? Okay. Now I take this opportunity to introduction of our chief guest, Professor Sukhpal Trehan, Madam Ji. Madam have completed her PhD from Department of Pulmonary Medicine, PG, MER, Chandigarh, in the year of 2002. Certificate course in Essential Palliative Care in 2008, and postgraduate diploma in Statistics from Punjab University, Chandigarh, in the year of 2013, and postdoctoral fellow of NRSI. About experience, clinical and teaching, about 32 years of teaching experience Madam is having, and life member of a scientific bodies like a member of editorial board of various national and international journal assistants, and about research, funded research projects about 24, including ICMR, DST, and DBT. And Madam has presented many paper presentations and invited as a guest faculty number of conferences and workshop publications in reputed journals around 250, and chapters in books around 37. And Madam has edited books around 9, written patient education books around 21, and Google Scholar citation around 1,700. Madam field of interest is around research, geriatric care, oncology and palliative care, chronic illness and women's health. Now I invite ma'am to give her message. Supal ma'am, over to you ma'am.
Yeah. Am I audible?
Yeah.
Yes ma'am, please.
Okay. So good morning, distinguished guest, Professor Suresh Khanna ji, Dr. Bimla Kapoor ji, Dr. Qureshi ma'am, Dr. Swati, Dr. Muthu, esteemed researcher, and dear participants. It is indeed a great honor and privilege to be here today as the chief guest for this prestigious research presentation conference. I would like to begin by expressing my appreciation to the organizers for putting together such a valuable platform for the intellectual exchange. Conferences like these are vital as they serve as a meeting point for academic minds and researchers to share their ideas, innovations, findings, pushing the boundaries of knowledge in their respective fields. Research, as we all know, that it is the cornerstone of progress. It is through research that we challenge existing norms, explore new perspectives, and pave the way for advancements that benefit the society as a whole. The papers that will be presented today are a testament to the hard work, perseverance, and creativity of the individuals who have dedicated themselves to expanding the horizon of their disciplines. I commend each and every one of you for your commitment to advancing knowledge in the field of nursing. In fact, research provides a foundation upon which solutions are built. I am particularly excited to see how the work presented here today contribute to addressing some of these critical issues. For the young researchers today, I would like to emphasize that research is not just about publishing paper or receiving recognition. It is about the curiosity, asking the right questions, and contributing to the greatest good of humanity. The research journey can be long and challenging, but the outcomes, even if not immediately apparent, have the potential to make a significant impact in the future. So I encourage you all to continue pushing boundaries, collaborating with others, and remain passionate about your work. To the seasoned researcher and mentors present here today, thank you for your nurturing and guiding the next generation of scholars. Your mentorship plays a crucial role in shaping their careers and ensuring that they carry forward the torch of knowledge and innovation. So as I conclude, I would once again like to congratulate all the participants for their hard work and dedication. I look forward to hearing about the groundbreaking research that will be presented today and to witnessing the fruitful discussion that will undoubtedly be followed. Thank you once again, and I wish all of you a productive and inspiring conference. Thank you so much. Thank you very much for having me here, and all the best to all the presenters today. Thank you very much.
Thank you, ma'am. Thank you so much for your blessings, ma'am. Now I take this opportunity to introduce our second guest of honor, Professor Dr. Rita Lakani, ma'am. Madam presently working as a principal in Mangal Institute of Nursing Education, Maharashtra, former principal of D.Y. Patil University School of Nursing,
Thank you, sir.
Nehru Nagar,
Can
Mumbai.
please, Rita, she couldn't make it. Her mom is in ICU. You carry on
Okay, ma'am.
with the next, please.
Okay, ma'am. Okay. Now I take this opportunity to introduction of our resource person, Professor Dr. Anuj Jayakutti, ma'am. Madam is an energetic personality who is always stand to keep the nursing profession high, and Madam is a treasurer of NSS National. And Madam has completed her graduation in the year of 2008 from Dayanand Sagar College of Nursing, Bangalore, and post-graduation from Dr. M.U. Shetty College of Nursing in the year of 2012, and doctorate in the nursing from Sri JJT University, Jaipur in the year of 2023. Madam currently she is working as a professor in Shodha Institute of Nursing in Rajkot, Gujarat. And Madam has published midwifery case books for JNM and BSc Nursing, midwifery textbook for JNM and BSc Nursing. And Madam has published 20 papers in national and international journals. Madam has been a moderator, resource person, and a master of ceremony for various national and international conference, webinar and workshops, and she is an examiner and paper setter for various universities. Madam is a member of various organizations like NSS, TNI, NTI. Madam has received Star Performer Award from Apollo Hospital, Chennai in the year of 2009 and also received BLS training. Ma'am, over to you, ma'am, for your message.
Thank you, sir, for a beautiful introduction. First of all, a warm greetings and wishes to all the gemstones of nursing present today in this platform. Our patron madam, Bimla ma'am, Shashi ma'am, our chief guest, Sukkal ma'am, then ma'am, and all the people over here, Muthu sir. So I first of all express the gratitude in front of all of you. You have given the chance to honor as a guest of honor. So that means a lot to me. A great initiative by National NSS. It will create a way for the researchers to present themselves in this platform. So today, the research presenters, they will showcase the culmination of dedicated efforts, the rigorous investigations and innovative thinking. So these researchers have delved into the complex problems, employed cutting edges, the methods and tools, and uncovered the value insights. And we know the research is the backbone of progress that will be driving to the innovations and improvement in our society. So it's very important that we need to work on this, and it should be presented and demonstrate. This will be presenting the power of inquiry, critical thinking, and collaboration. So obviously, these presentations will inspire us all to continue exploring and questioning, and also seeking the solutions. So I congratulate all the researchers who have come forward to present today and to accomplish their results, and wish you them a continued success. And once again, thank you so much for all the executive members and all the NSS members, and Patron ma'am, Bimla ma'am, and all the my senior leaders to guide us always. Thank you so much. Thank you all. Have a good day.
Thank you. Thank you. Thank you for your blessings, ma'am. Now I take this opportunity to introduction our special guest, Professor Dr. Bimla Kapoor, ma'am. Always she is there behind us as Khanna ma'am there. Even madam also always she'll be guiding us. It gives me immense pleasure actually to introduction of our madam Bimla Kapoor ma'am, and our respected Iron Lady ma'am Bimla Kapoor ji is our state national advisor. In addition, he is also a senior nursing advisor role in CNRS. Madam has 50 years of professional experience in a variety of professional settings, and Madam is a pioneer in distance in nursing at national and international levels, and has been a chairperson and expert in National Nursing Bill Committee with the Minister of Health and Family Welfare, Government of India. The bill is now in a new law. Madam has published extensively, authored her very first book, Psychology for Nurses, which is still held as a key book to study to gain skill for rendering quality care up to the patients. Now I invite Madam for her message.
Thank you
Over
so
to
much,
you, ma'am.
Dr. Muthu.
Thank you.
Thank you so much, Dr. Muthu. Dear patron, Dr. Khanna, both the MC members who are doing wonderful job, President Binu, who is on the wheels but always present, Joy Kuti also, Dr. Aisha Qureshi, it's pleasure to see you. Also the guest of honors, and I'm so sorry to hear about Rita's mom being in ICU. We wish the quick recovery to her mom. Very dear research presenters, and also the people who are participating in today's presentation. I really feel very proud when the people come and do the research presentation. It is not so easy, to get back to your research study and come and do the presentation. But I think you do a wonderful job because you disseminate the information, like Anu said in her message, that dissemination is very important. And once the dissemination is done, probably the 50% purpose of the research is achieved, because out of 10 people or 20 people who will be listening, or 100 people who will be listening, if 10% of them they follow while they are practicing in their clinical area, probably you have achieved the objective. And that is the reason Dr. Khanna thought of that we should have the research presentation so that larger body can hear your findings. Also, I appreciate the concerns which Dr. Anu Joyakuti also mentioned, that we need to really apply the knowledge what we are gaining. And both of you are going to do the presentation, are in positions to see that you are able to not only disseminate but also apply the findings of the study, so that we are able to bring a change in the patient care. So patient care outcome is very important, and ultimately our goal is strengthening the clinical area, strengthening the nursing education system, and that's what I think the presentation takes us forward. Well, let me wish you all a very happy Diwali, and also to all Gujarati friends. I didn't know today is a New Year day for Gujarat. So wishing you all the Gujarati friends a happy New Year and happy Diwali to each one of you. Welcome, and wish you all the best for your presentation. I was indeed very happy to hear Dr. Sukhpal. Thank you so much. Looking forward to hearing you.
Thank you, ma'am. Thank you so much for your blessings, ma'am. Now I take this opportunity to introduction our Asha Qureshi, ma'am. Madam is a president of SNT unit, and always Madam also is here to guide us. Dr. Asha Qureshi, Madam, a well-known nursing leader, seasoned publisher, and expert researcher. Madam has been associated with Galgotia University since 2014 till 2021. After rendering 45 years of services at AIIMS, she has to her credible professional experience of over 50 years. Madam has completed a PhD in public health, and she is also MBA from Modern Institute of Management, Newport University. Madam has joined ND in the year of 1972, retired after superannuation in the year of 2014, October, worked as a various capacity of PHN with WHO projects, clinical nurse educator, administrator, researcher at AIIMS. Her area of interest includes community health nursing, nursing education, nursing administration. She has her credit more than 30 research publications in national and international journals. About awards, Madam has awarded with the Mahila Shiromani National Award from President of India in 1995 for the best community and patient care services. Rajiv Gandhi Excellence Award from NRI Society, India, Delhi from Health Minister for best community voluntary services. And Lifetime Achievement Award during the International Nursing Conference 2017 and Excellence Legendary Mother Teresa Award from NRI Society presented by Lord Swaraj Paul presented in the year of 2019. Lifetime Achievement Award from Nursing Scholar Society in the year of 2020 and life member of 20 professional bodies such as TNI, NRS, INSS, PHEI, World Population, Geriatric Society, Global Health Conference USA, and many more. Madam has participated as a resource person in almost 50 conferences nationally and internationally. BOS member in various university selection committee member, edited journals and many books. Completed OB, HRM, TB certification program of 6 months from Nepal Swam with the Gold Award. The secretary in his chapter.
Yeah,
joined.
hello. Yeah,
Yes,
I'm
ma'am.
sorry, my internet went away.
Yes, ma'am. Over to you, ma'am.
Yeah. Thank you, Dr. Mittu, for giving my introduction. And I'm very pleased, to have this presentation, which was started by our leader, Dr. Khannaji. And it is under her leadership, it is continuously going on, in a very smooth manner. And I know that it is very informative. All the presentations are very informative, and they are doing a lot of effort, to come here and present their, findings and results and all. And it gives the opportunity to everyone to apply that in the clinical setting. And, so this is a very good forum. We have got this forum, with the grace of God and with the grace of Dr. Khanna. She is leading us so well that continuously every month this particular, event is going on. So I wish all the presenters, that for your good presentation, and I wish everyone happy Diwali and happy New Year and happy Halloween. So thank you so much.
Thank you, ma'am. Thank you for your blessings, ma'am. Now I take this opportunity, today's keynote speaker, Mrs. Meena Patole, ma'am. Madam is a dedicated nursing professional, 37 years of experience in clinical education and administration, proven leadership skills with expertise in nursing education, nutrition, and patient care, passionate about empowering nurses, promoting women's rights, and advocating for quality healthcare. Madam has completed HSC from General Education and RNRM KM Hospital in the year of 1997 to 1981, and based nursing Mumbai University from 1889 to 1991. And PG in nutrition from IGNOU, and diabetic educator course also Madam has completed, and IELTS certification Madam has completed. About professional experience, staff nurse at KM Hospital, sister tutor at KM Hospital, sister tutor at Bhagavati Hospital, sister tutor at LTMG Hospital, and vice principal at LTMG Hospital. About leadership role, state SNA advisor TNI between 2014-2018, and SNA advisor Mumbai City branch. Executive Committee member, Infection Control Committee, LTMG Hospital, Core Committee member, Sexual Harassment at Workplace, LTMG Hospital. And about achievements, organized and conducted conferences at Panchgani and Aurangabad, represented Maharashtra, winning first prize for the best performance and activities. Conducted competitions for students with a good response, felicitated by Hospitals Royal Service Association, won prizes at various competitions. About her areas of interest, reading, writing, soft skills, communication, music, and traveling. Over to you, ma'am.
Yeah, thank you so much, Dr. Muthuji, for this lovely introduction. It's a very nice day and very, I think, for great day for me, because Madam always believes in me. So, respected dignitaries on this digital platform, Dr. Emeritus Suresh Narula Khanna, Madam. She's Madam, when I come to see you, I get thrilled, I see you, so I feel very nice that you give me this opportunity. Then all these stalwarts, our president and founder, Dr. Binu Jo, sir. Then today's chief guest, Professor Dr. Sukhpal Tehran, nice message she gave. Then our guest of honor, Professor Dr. Anu Joyputty, nice to hear her. And very sorry to hear that Dr. Rita Dudhani is not there because she's my colleague, she's my senior, and we are best friends forever. So I'm missing her and wishing speedy recovery for her mother. So today we are going to talk about mental health, and I also welcome and give my gratitude to Madam Bimla Kapoor and Madam Aisha Qureshi, because from Bimla Kapoor Madam only I learned her books were there, part 1 and part 2, psychiatric nursing, and there I learned about mental health. See, what a coincidence that we both are on the same platform. And here I am to talk about the strategies that we have to maintain for the nurses at the workplace. At the workplace, that is very important because most of the time, nurses are spending at the work. Work culture, work environment plays a vital role in nurses' life, everybody's life. So challenges faced by nurses. Many challenges are faced by the nurses in nursing profession, like maintaining work and home balance. Then while traveling, she has to travel for quite a long commute for a long period. Then her physical and emotional demands are also there. We forget that she is also a human being, and she too has physical and emotional demands. She has to maintain her intelligent quotient as well as emotional quotient. That is very important, because if her child is sick at home, she's leaving that child at home, giving medication and going to the pediatric ward and giving medication and care to the other child. While giving medication to the other child, she of course remembers her child at home, and that's really a very sorry of her, but that's a part of duty, and she does it. She does it. Once you wear the uniform, you have that strength, that I am a nurse and I'm proud of nurse, and she dedicates her work. So, but things are like long working hours are there. Somewhere in a government hospital, 8 hours traveling to back and home, 18 hours. Then in private, more than 12 hours work, giving over, taking over takes a lot of time. Then work, difficult life balance, work and life, she has to balance. Then insufficient payment. Yeah, this is the major problem, Every union is fighting for the nurses, because here in Mumbai or India, private nurses are paid less than the government and BMC hospital. Inequality is there, and that is really injustice for them. In fact, they work more than the government and BMC hospital. I am from BMC. Once they wear the uniform, they feel they are dadas. Now nobody is going to kick me out. I am permanent. So I'll just come, give injections, give medication, and go away. But it's not like that at private institutions. Private institutions do not pay as per her capability, but ask her more hours. Then high stress level. Who is not suffering from stress? Everybody. But nurses really do suffer, because hospital environment is not like home environment or some celebration or something, air conditioned rooms and all that. So high level stress she's facing from all over. This one is demanding, that one is demanding, house is demanding, nurses, leaders are demanding. So there is high level of stress. Then there is burnout syndrome. Later on, we'll see what is burnout syndrome. The other slides has it. Then lack of support. Support system is very important. At home also and at the workplace also. If you are having good support system, you can do any bloody damn thing in this world or on this earth, That support system, like how support madam gives us, that you come up, you can do, my child, you are my comrade. Madam had called me. The day she invited me, from that day I started troubling her, messaging her and troubling her. She supported me and that motivated me. So causes of burnout, understanding the burnout. Yeah. There is once the nurse enters the ICU, specifically ICU critical care area, there's so much sounds, you know, tack, 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 pee, to zack, zack. Some machines are like that. You know, when I go to take a round in the ICU, for some time I feel, my God, within half an hour I got, you know, continuous AC. Sometimes some people cannot bear that continuous AC. They have knee problem, back problem. So this burnout syndrome, because of that, a lot of pressure. Every 2 hourly, 3 hourly, check everything. The monitor slips out, the oxygen mask is slipping out, patient is moving, and lot is demanded from her. So she has constant stress. She's working under stress. Oh, that patient has gone gasping. Oh, call this doctor, call that doctor, take the machine there, then all the machineries, and she has to work a lot. Then poor work-life balance, as I told you earlier. Then in ICU, she cannot say, now it is 3 o'clock and patient has become serious and I'll go home. Sometimes she has to work for extra hours, and that creates stress because her husband and family expects her at 5 o'clock and she reaches at 7 o'clock, and then she hears, why so much late today? Every day you come, you know, no children are waiting for you, my mother is waiting for you. Now how will she answer that that patient was gasping? I could not leave him gasping because life is precious for our nurses. So that is the poor work-life balance. Then lack of recognition. Nurses are
Pragati Patel, sir, one submission, ma'am. Sorry for the disturbance. Pragati, ma'am, please unmute yourself. Please don't disturb the. Pragati, ma'am. Pragati Patel, ma'am. Pragati Patel, ma'am. Please mute yourself. Ma'am, please continue.
Yeah, lack of recognition. You know, earlier in 70s, 60s, when we were doing our nursing profession, nursing, oh, she's only a nurse. Oh, it was like that because MSc, doctorate started later on. And she got recognition. Actually, after this pandemic, though, my God, nurses are before doctor. They are considered as God because the way they handle this pandemic, I really appreciate them. And they're really getting appreciation awards. And now everybody is sending nurses, their children for nursing. They don't want her or him to be MBBS, but they want her or him to be a nurse. Because they came to know during this pandemic, everybody was at home in lockdown. Only nursing warriors were at home. They gave immunization, vaccination. They took care in jumbo care, and that's how everybody. Because you know, in during this pandemic, when BMC was taking admission procedure, we at BMC we require only 370 nurses. We are having 5 nursing education center, and only 370 is the number we require. But how much form we received during pandemic, you know, ma'am? 2,500 overloaded online, and only 370 were lucky, chosen by the God who got the admission. Others were crying, actually. So that is how nursing got the recognition, and they deserve it. So big round of applause for them, you know, now from all of us. And then causes of burnout, understanding burnout, chronic stress. Then signs of burnout, recognizing burnout. She sits. She does not eat. I want to skip my lunch. I'm not going now. I can't sleep here. I cannot relax, you know. So recognizing her burnout and changing her field for some time, or giving her some incentive, or giving her some power nap time. You know, power nap really helps to come out of this burnout syndrome. Then emotional exhaustion. Every now and then, that patient is gasping, that patient is fractured, that patient is I took so much care and the patient died. My God. Then mother is crying, child is crying, and everybody is crying, but you cannot cry. You have to control your emotions. So you have to keep your emotional quotient very high, very high. Even when I come back to room, I cry. I tell my student also when she takes the case study in pediatric ward, madam, I gave care for 15 days, but the patient could not survive. I said, don't cry in front of him. Console the mother. Ask her to accept. First step is denial. And gradually she will accept. So we have to tell them this. Then cynicism means you have to trust your nurses. Your patient trusts you. If your seniors, doctors do not trust you, get frustrated. Because whatever doctor writes and we give to the patient does not ask, what injection are you giving me? What tablets are you giving me? They believe that whatever sister and doctors are doing is for my betterment. And I want to go home as early as possible. No, that is very important. Then reduce performance. If she's constantly kept in that particular area, which is very heavy. Like when I was working in KEM hospital as a staff nurse, 100 ward state, 100 patients, 50 IVs, only one staff and 2 students. By the time we take temperature, pulse, respiration of 100 patients, again round comes of taking second round, giving injection at 2 a.m., giving injection at 4 a.m., then 6 a.m. dose, and then handing and taking over used to take a lot of time. So it was very crowded hospital. Wherever I worked, even Sion Hospital has a best trauma center, because it's on highway. So all the patient keeps coming there. Then self-care strat. Every time we all forget that self-care is so important, not only on mental health day, but throughout the year or throughout our life. In the morning when I get up, I say, I love myself. I'm looking beautiful today. Madam will appreciate my sari. What sari should I wear? So many saris I kept ready, So self-care is very important. Prioritizing your self-care, priority. You is priority. Then if you are safe, you are healthy, you will keep community, your family also healthy. So pay attention to your health. We always pay attention to others' health and we neglect our health. My head is paining for so many days, but forget, I do take some tablet medication and I'm having giddiness. Okay, I will not check my blood sugar, but let us see. But prioritizing self-care is very important. Physical, mental, social, and spiritual also, the health definition tells us. Then mindfulness. Just do a meditation. Concentrate. Mind is constantly wandering. This thought, that thought come into our mind, and then we are not able to control, not able to focus. Focus. What is the priorities? That is why at least you start doing meditation, mindful meditation, and do it for 1 minute first day, 2 minutes for second day, 3 minutes for third day, 5, 15, 30, and like that you will get used to it. To cultivate the habit, you take 21 days. So if you continue the process, you will definitely have good effect on your soul, body, and mind. And you will be able to focus. Exercise. Very, very, very important to be fit. Very important. But nobody, when I was there in Sion Hospital, I went to that cultural center and I told them, we want a gym. We want a yoga center. See, I am putting on weight and I am really worried about it. So we want some gym here, sir. We'll come before half an hour to our duty hours. We'll go there and exercise. Nurses fail to do exercise, and that is why they cannot run around, from this corner to that corner, because they get so exhausted. Exertion is not exercise. Breezeful walk, doing yoga, asanas, very important for you. Take out some time. 10 minutes, 20 minutes, half an hour, you cannot give excuse. I don't have time to do exercise. Why not? Why not? Instead of getting up at 5:30, get up at 5 o'clock. 5 to 5:30, you can always do your exercise. So exercise is very important, which improves your physical and mental health. Then meditation, I already told you about. Then journaling, noting down. Very important. My today's plan and tomorrow's plan are ready. I keep note of my plans, anecdotes kind of thing. Maintaining a diary so that you will not be in chaos. What should I do now? What should I do now? Since 4 days, I'm deciding which sari. This sari is given to me on my retirement by my best friend, and I have not owned. So this is the first time I'm wearing it, so I felt so nice. Journaling thing, noting down what to-do list, what to do today. Today, tuition fee, then going to hospital, then doing this work, planning your nursing care plan properly, finding out the needs of the patient, implementing, all those things are very important. Then social support. We always say what people will think. If I'm having a mental illness problem in the house or at workplace, what people will, she's mad. Mental health is not madness. Mental health is an issue. Mental health is an illness like physical illness. Physical illness can be seen, but mental illness cannot be seen. The person who's facing it knows what she's going through. So overtly it cannot be seen, but social support is very important from the society, organization, and family. They are not vocal. So unmute yourself what you are going through. Tell everything somewhere, vent out. Venting out is very important, and that is why friends, I always went out to my friends. They give me listening ear, If I'm going through certain trauma or some struggle, what to do. Now this PPT presentation, I was having some problem. So I got hold of Prachi Dharap madam. I said, I'm writing content, everything, just prepare some PPT. So this credit goes to her also. We should not miss to appreciate anyone, That is how social support, friends. Then relaxation technique, relax for some time. Go for outing, arrange picnic, go to the gardens, do gardening, learn music. Music a good healer, So where are we now? Workplace support. Workplace support is very important because I told you maximum time is spent on at workplace. So creating supportive work environment. If you're not able to do some certain thing, you can tell your senior that I want little 15 minutes rest. Can I hand over this to you? And she says yes. If you tell your sister in charge, now I'm feeling some giddiness, can I just have some water or something for some time? And then, this work environment is very important. Our BMC hospitals and government hospital do not have, very sorry to say this. When I was working in this hot environment, now we have only 2 weathers, madam, here. One is rainy and another is hot, summer. In between, some cold season comes 1 or 2 days. And that BMC fan is put on in the year 1950, before I could born. So it goes like this, very slowly. Shh, shh. When I go to teach and when I stand in a classroom of 100 students, their breathing, my breathing, no sufficient ventilation, no sufficient fan, man, I have to teach. And they also have to learn. It's like that. So that environment is very important. Then open communication. One-to-one open communication if you're having with your team. You can see the team holding each other and have an open communication with each other. Communication is very important. Nurses are always submissive. They don't communicate. While doctor is going for a round, you communicate with them. So you will feel very nice, Communication is better part. Wishing, saying good morning, some positive affirmation will also help you developing your mental health. If you are having good relations now, like all of a sudden I am here on this particular platform because of my communication. That is what I feel, because Dr. Binu Jo sir first gave me opportunity to take a lecture at Jamnagar, where he is working for the nurses, BSc nursing nurses, on soft skills webinar. That was the first webinar, of mine, and that is how I remember Dr. Binu Jo sir. So team building spirit should be there. There are so many people involved in team building. So for the team building, have some continual education, have some creative activity, recreation activity, involve doctors, surgeons, then dietitian, occupational therapists, physiotherapists, everyone, you, sister in charge, staff nurses, student nurses, all come together and build the team. The team that is built properly can be led properly and can work very productively and give quality output. Here we are preparing the nurses to provide quality and comprehensive care at the bedside. This is my definition first I tell my students. Very important. So, team building, mental health resources should be available. Resources are, lack of resources are there. Where will she go when she is going through some struggle, mental issues? There are psychologists, there are counselors, there should be psychiatric wards, psychiatric doctors. We really had, and whenever I had a problem, I never felt shy to go to psychologist and have a counseling. Madam, what should I do? I'm feeling very anxious now. This conference is coming. Will it go well? I'm very anxious because I'm holding for all over the Maharashtra. And there are around 1,000, 2,000 students are coming. So how to handle accommodation and eating place and in these panel discussions and seminars, all that very important. So employee assistance program should be always there. How can we assist you? What should I do for you? Once she goes to the head, they can ask her, what can I do for you? What assistance do you require? In which area? And that area should be chosen and assistance should be given. And then flexible scheduling. Your schedule should be flexible. 3 hours working or 4 hours working, 5 hours working, 2 days leave, so that she comes out with good health and good productivity. Next slide. Boundaries setting is very important. Setting healthy boundaries. You should set your boundaries where you can put your maximum amount of energy. Set the boundary. Be content. I will do this also. I will do that also. I will do that also. So, what happens? Then you get frustrated because you cannot complete one work. So set the boundaries. Prioritize your task. What has to be done first? What has to be done next? What has to be done third? Put them in a sequence. So prioritizing your task will keep you calm and quiet. And then set realistic goal. Your goal should be realistic. Just like that, something you are drawing and doing it. No. Your real goal should be there, that I want my patient to be all right, as well as I want myself also to be fit and all right to take care of my patient tomorrow. So realistic goal is very important. Then learn to say no. It's very difficult task sometimes. We always say yes, nodding our head. But there is nothing wrong. It's always okay to be not okay sometimes. Always you're okay and always you're fine, not good, not acceptable or not possible. So whenever you feel that I'm really exhausted and I cannot do, but she loves me, doctor loves me, we want this sister only because she does the work wholeheartedly. I was always demanded, but I was exhausted. 8 units in female surgical ward with 200 patients. No, madam, don't put me in that ward again. After 6 months, you can put me again. That is how it can be done. So establish work-life balance. I have already told you, you have to balance your house as well as your workplace. Then communication needs. As I told you, communication, talk to your patient. Our nurses, when they go, they wear a mask. They don't communicate at all with patient also, with their colleagues also. Their voice is so high, it is high pitch. Specifically, the institutes like government, BMC, hey, oh, the trolley noise, that irritates you also, your colleagues also, and your patients also. They are very important to us. So communicate. Assertiveness training. Assertiveness means be presentable. Looking at you, patient should feel, oh wow, sister is so beautiful, so her care will be very beautiful, very nice. She's always having smiley face. That face only is very important. Once we go to see the nurses, my God, they're always tired, overweight, and then whatever work is given to them, they do that and go to nurses' station and sit. It should not be like that. That will not create a good impression on the patient, and that will harm you too. So how organization support can be given to strengthen the mental health of the nurse at workplace? Organization strategies for mental health. Find out who is not feeling well. Keep the data of the nurses. Then mental health policies should be drawn, how to maintain the mental health. For that, round the clock duty, how many hours she's working, what kind of work she's going through, what kind of problem she's going through. So keeping some counselor at nurses home or hospital and referring the nurses. We had that program, screening programs, So this is very important, that having some kind of mental health policies. Then training for managers, because most of the time nurses get scared of that sister, oh, I cannot stand before her because she's very strict. She sees a tray like this. What did you do in the night? See this tray, how the dressing trolley is prepared. This trolley is not good. Sometimes the trolley in the operation theater is not prepared and that scissor is not cutting. Doctor throws on your mouth or doctor throws it down. What is the sister? Because he's also undergoing pressure, you're also undergoing pressure. So that is why training those managers are very important. The sister in charges, the managers, the CEO of the hospital, they think they are boss and they can talk very loudly.
Ma'am, one submission, ma'am.
Yeah.
Ma'am, we are running with out of time.
Yeah,
ma'am,
yeah.
please.
So mental health, employee recognition, mental health days, employees assistance programs. Next. I know I talk a lot because there is a lot to talk. Dr. Bimla Kapoor has taught us so much on psychology,
Yes,
This full
because
session
again,
I
the
wanted to
presenters-
have. Yeah, next time,
Yes,
maybe.
yes.
Then
Yes,
Nurses Association support like NSS, TNAI. There are so many organizers, NGOs can help. Crisis hotline should be there immediately if she can connect to someone. Then online support group should be there. And local mental health services should be provided. That is very important. So positive affirmation, I forgive myself for my mistake. Everybody can repeat. I forgive myself for my mistake. My challenges help me grow. I choose my own attitude. All of my problems have solutions. I am choosing to have an amazing day. I am amazing. I am proud to be a nurse, and there is no one better than me to solve my problems. So here I would like to say that one day only, not one day, but every day can be celebrated as Mental Health Day. We all will smile throughout the year. So take action today, prioritize self-care, seek support, advocate for mental health policies, educate your colleagues, create a supportive work environment. Then conclusion, again prioritizing mental health in nursing, healthy workplace support, nurse well-being, call to action. Let's work together to create a supportive environment. And smiling image I did not put here because all of us want, I want you to smile to end this particular my speak. Thank you so much everyone for giving me this wonderful opportunity to talk to you. What are my feelings on strategies? Thank you, Madam Sukhanna, Binu Jo sir, Aisha Qureshi madam, Bimla Kapoor madam, And Dr. Muttu, thank you so much. And
Thank you,
best
ma'am.
wishes best wishes for the further presentation. Thank you so much.
Thank you, ma'am. Thank you for your wonderful session, ma'am. Actually, myself, Dr. Muttu P. Chowdanavar, I am the president for NSS 4th year chapter 15 Karnataka. I am the second master of ceremony actually. In addition to that, I have a doctoral degree in HC, and along with that, I have completed my MSc in nursing with the community health nursing and MBA in hospital administration. And currently, I'm working as a NFH consultant at KIMS Hospital Hubli, and even I did consultation for so many hospitals for entry level and full accreditation hospital. And I have received many certificates, award, published many articles in referred journals, and even I have completed my TOT course in midwifery faculty development program in nursing from Delhi, and I'm a certified internal assessor for Kayakalpa, Inquas, Muskan, Laksha programs, and even I am a certified in Lean Six Sigma, that is green, yellow, black belt, and I'm a life member many nursing associations like TNA, NTI, NSS, NHS, and IAP, FNSC, etc. And as I am a certified master trainer in simulation-based education for NSC New Delhi. Respected Khanna ma'am, respected chief guest Professor Dr. Sukhpal Tren ma'am, and guest of honor Professor Anup Joykutti ma'am, and Professor Dr. Rita Lakkane ma'am in her absence, and NSS President Professor Dr. Benu sir, and special guest Dr. Bimla Kapoor ma'am, and special guest Professor Asya Qureshi ma'am, and today's keynote speaker Ms. Meena Patola ma'am, and the eminent speakers of today's events and NSS members and all the participants. It's my honor and pleasure to be here as a guest of honor and master of ceremony in this research presentation series. Nursing research has a tremendous influence on the current and future professional nursing practice, thus rendering it an essential component of the educational process. This research presentation series are providing opportunity to the students, clinical nursing personnel, and faculty members, budding nurses to gain knowledge from their nursing leaders and disseminating and utilize their research finding in the different areas. I would like to thank respected Khanna ma'am for initiating and providing the platform to nursing personnel disseminate their PhD work with others. I wish to all our today's research presenters that your productive work will be utilized by the individual and the society. And these are the today's presenters. First, Professor Dr. Pratibha ma'am, and second with the Professor Dr. Suresh R. sir. So our first presenter, introduction of first presenter, Professor Dr. Pratibha Chandrasekhar ma'am. Dr. Pratibha ma'am, I have a 33 plus years of professional experience in all the varieties of setting and currently working as a principal cum professor at Dr. V.V. Patil Foundation College of Nursing. Madam is a member of various committees and chairpersons of some, in addition to the role of observer, evaluator, inspector, resource person. And Madam has attended, participated in the workshop, conferences at local and state and national and international levels. Madam have written many book chapters and books. Madam have researched that 25 articles are published in referred journals and has been contributing to nursing profession through the Punjab Nursing Council. Madam is a member of NSS, NTI, TNI, NRSI, SOMI, AAMRHI, and CMAI. Madam has many awards from the state and the national level agency. Now I invite Dr. Pratibha ma'am for her research presentation. Over to you, ma'am. Pratibha ma'am.
Yes. Thank you, Dr. Muthu sir, for your kind introduction. And once again, I appreciate and salute all the stalwarts here on the dais who are sharing virtually. I don't want to take more time. Once again, thank you for giving me the opportunity to share my PhD study. It was a long journey. And there is a big history, but it was a journey started in 2001 and ended in 2009 by awarding the PhD degree because we didn't had any guide. And I struggled to find guide after registration for 1 year. And then I started my study. After submission in 2005 also, the actual my PhD Viva was scheduled in 2007. And finally, the Viva was declared in 2009. So it was a very long journey. And I couldn't present this paper, neither I could publish because the data was collected in 2002-03 and then after 2009, and nobody guided that I had to publish the paper. So once again, thank you, the Scholars Society, for giving me this platform to present my PhD study. Okay, so straight away I move ahead with this presentation because I have to attend church at 10 o'clock, please. Yes. Muthu sir, I just wanted to request you. I
Yes.
have the hyperlink. So I have already
Okay.
provided the hyperlink. So when the
Yes.
findings of the study will come, hyperlink. So whether you have in your desktop my the findings.
Yeah, PPT, whatever you have shared, ma'am, it is there, ma'am. Already I have added in the presentation.
No, then a PowerPoint. But to support my hyperlink, you need to have the on your desktop my this thing also findings.
Yeah,
I
all the
think that
hyperlinks
Otherwise,
has to
then
be there on the desktop.
otherwise,
Then
it is
sir,
there,
only
ma'am.
you
It
can
is.
if
open
you
it.
can make me co-host,
Ma'am, I think just have a look, ma'am. Everything I have added here. Just have a look, ma'am. All thing, whatever you wanted, that hyperlink, everything I have added, ma'am. Here. Just have a look,
no,
ma'am.
sir. This presentation is absolutely okay. I have seen it. But when
Okay.
the hyperlink will come, so this hyperlink, whether you have in your desktop, the Word file which is sent separately.
Okay. You can share your PPT, ma'am. Not a problem.
You made me co-host?
Yeah. Just a minute, ma'am.
Dr. Pratibha, have you sent him the hyperlinks
Yes, I
to
had sent,
be
ma'am.
stored in
But
his
if he makes
desktop?
me
Yeah.
co-host immediately, it is there on my desktop. If I will be made co-host immediately. I'll share my screen.
Ma'am, you can share the screen, ma'am. Just see, ma'am, once. You can share it. You can share.
Okay.
Hyperlink, you can do it from your desktop also.
Yes, ma'am.
Muthu, just open one hyperlink and just see that it can be open or not.
Yeah, just a minute, ma'am.
If it can be open, it means it is in your desktop.
Just I'll let me check, ma'am. No, it is not there, ma'am.
Yeah.
I
Ma'am,
think
you can share, no, ma'am.
Yeah, I'm sharing. I am
Yeah.
sharing now.
Please.
You can share all the hyperlinks in the form of zip folder.
You are able to see my screen?
Yes, ma'am. Yes, ma'am.
Yes. Yeah, the title of the study was a study to develop the self-instructional manual for mothers in caring the under 5-year children with acute respiratory infection. Now, this was in the partial fulfillment of PhD. Since the ARI among the young children is life-threatening, and 40% of the global ARI mortality is seen. And yesterday also, I was just looking out. Still, pneumonia is the among the top 5 mortality reasons among the under 5-year children. That means it is a real global ARI mortality threat in entire scenario. So then we nurses have a role to how we can reduce this. So that's why I had taken this study. So 30 to 50% of the visits of health facility is because of ARI that we see. And around 5 to 8 episodes of ARI per child per year is the data that is published by WHO, and still it exists and it is going more and more. So parents who are in front line of clinical management of children with ARI, So they have to understand how to take care of the children with ARI and how we can control it. So parents need simple, straightforward messages. And this specially made me to take this topic because I was taking my nursing student. So I was, Meena Patole ma'am is my colleague. We both worked together in KEM hospital. So when I used to take my students in the urban health center for clinical posting and rural health center, so I used to observe all the time the mothers used to come with cold, cough, fever, constantly, repeatedly, and then many times the pediatrician was not available. I used to feel so sorry about it, and then this made me to take up this study to make straightforward, simple messages for the mother. So this to develop a self-instructional manual. And naturally, when this manual is given to mothers, so repeatedly they can read, and then this can be a reinforcement for them. So this study was undertaken in 2 phases. So phase 1 was to study the prevalence of ARI among the under 5-year children, and then to assess the existing knowledge and their practices, and then to assess the information need, and then prepare the self-instruction manual. And in phase 2, it was to educate the mothers regarding ARI with the self-instruction manual. Personally, I visited to the mothers and then explained them with the help of manual. And then after that, whether this became effective or no. So knowledge of mothers in caring the children who received the ARI. So for this, the literature review, the past literature among under these 5 categories. I reviewed the literature, and then from that literature, I found that the ARI places a considerable strain on the health services throughout the developing world. And then I also found inappropriate antibiotic use for cough and cold. And now currently in 2024, now we are facing, even now in front of India, it's a big threat because of inappropriate and misuse of antibiotic is leading a threat of becoming resistance. So, and very few caretakers know the correct home care of the children with ARI. And then, so while developing the SIM, the patients need use of language, local terms. All these are important, and then to avoid medical jargons when we are giving the messages. This all I came to know through the review of literature, and I took care that these things are implemented in my study. So this was the first phase was descriptive survey to find the what is the existing knowledge and practices, and then the prevalence. Even under 5 children also were assessed, and the mothers also were assessed for their knowledge and practice. And then the second phase was to evaluate. So this was an experimental study. So the Solomon 4 group design was used. So for this, 2 group were study group, 2 group were control groups. And this study was done in the heart of Mumbai city, Naigaon maternity home. Under this, the health post were there. And under this health post, the Bombay Municipal Corporation. So all the police quarters and the BDD Chawl in the Dadar and Naigaon area, this study was conducted. Then in 2001, the study was registered, and then the data collection was done between 2002 and 2003. So the sample size, 100 mothers and 100 children for the phase 1, and then for phase 2, 60 mothers. And this data was available already in the health center. So from them, I took it, and then randomly I just ticked. So then randomly the mothers I have picked up for the study to enroll. So the tool and technique, the interview technique was used, and then the tool was for phase 1 interview schedule, even for phase 2, the interview schedule. The self-instructional manual was the tool as a intervention for teaching. And then what is the opinion of the mothers regarding the self-instructional manual that was done for them, because the study was to develop the self-instructional manual. So to try out was also was the main part of the study. So it was for clarity, for adequacy, for suitability, and then usability, and overall, what was the opinion of the mother? This was the opinion poll that was asked. So the finding of the study, so it was done in the descriptive and inferential statistics, so frequency percentage, and then to see the significant difference, the t-test, the post-test of all 4 groups was done, and then since it was 4 group, so ANOVA was used for this. Is the screen visible, the findings?
Not yet, ma'am.
So hyperlink is visible,
Yeah.
but it is not
Did you get the
opening.
hyperlink?
Yeah, we
You
got
are
the
able to see?
hyperlink. Open.
Yeah, we are able. Yes.
Yeah, you can open it now.
No, I have opened it. Are you able to see it?
No.
Yeah,
No,
we
ma'am.
can only see the heading of
Your link.
hyperlink,
Streaming.
not
Okay,
the
okay,
findings.
okay. Okay.
It is showing that it is still downloading.
Acha, it is showing downloading.
Yeah.
Then you got
ARI study
Oh.
findings hyperlink document.
It has not opened, ma'am.
No.
No.
it's downloaded. Maybe from the download you have to open, madam.
Open.
It's download to you. The download file.
Ma'am, you just go to download. I think there it will be.
Okay.
You put your cursor on the download.
Then again, maybe that is also share is to do that.
I'll do one thing. I'll stop sharing this and I will just directly open the hyperlink
Please.
I have on the desktop. Again, I will share it. That will be more better.
Now you focus on the hyperlinks, the major findings.
Yes, ma'am. Now you are able to see my screen?
No, ma'am.
Now the video is stopped.
No, ma'am. Ma'am, if you have, I can read those things, ma'am, without this also, I think.
I can just read from my side.
Yeah, that's okay, ma'am. Not a problem. Please, ma'am.
Okay, only thing you won't be able to see it then.
No problem, ma'am. No problem.
Okay,
It may
sir.
not be, you may not have stored it on your desktop, I think, hyperlinks.
It is there, ma'am. It is there on the desktop. Okay. So the finding of the study is mainly majority of the mothers were age group between 21 to 31 years, and then maximum were Hindu community, and moderately high percentage had primary education, and very few were illiterate, and majority of them were housewives, and then their family income was less than 5,000 rupees per month, and they lived in chawl, and majority were having joint family, and maximum families had one or two child, and then yes.
Ma'am, please, you can go ahead, ma'am. Please.
Yeah. So at the time of survey, the children having ARI showed that majority of them were first child in the birth order. So this is the implication for the study mainly because majority were having the first child. So they didn't know how to take care of the baby. So that's why we as nurses have to take care that during the antenatal period and immediate postnatal period, we have to educate these mothers. So the under 5-year children, so maximum children belong to the infant group, and then moderately the toddler group, and some belong to preschool age group. And then to some extent, home delivery is still prevalent in that chawl or the hutment area. Then children's birth weight, maximum children's birth weight was below 2.5 kg, and then maximum children's were born full term. Then 9% of the children had history of illness, which is serious in nature. Out of these, 3% of them were admitted and treated in the hospital, whereas others were treated in outpatient department. So, and 50% of the mothers do not know the respiratory disease condition, which commonly occur during childhood. So this was the finding. And then 8% of the mothers do not know the reason of a respiratory infection. So, and the others who knew, they knew partially. So 50% of the mothers do not know the signs and symptoms of ARI, and they didn't know the negligence of cold and cough will lead into a serious illness. So majority of the mothers did not know about the danger signs of ARI. So the other findings were caring the child in illness. So majority of the mothers said they will seek medical help immediately if there is a serious ailment when the child is having respiratory problem. Then 50% of the mothers do not know the medicine that is given to the child having ARI. Then 50% of the mothers do not know the reason for putting oil in the ear and nose, and still they were putting. So, then they didn't know how to do the cleansing of the child's blocked nose, and less than 10% mentioned the correct practice. So 55% mothers said child should be put warm clothes. Okay, so maximum mothers use different home remedies. And then regarding feeding, the mothers strongly agree that the child should be given the breastfeed within half an hour. So that was very good, I felt. But then still maximum 100% mothers should know that they should give the breastfeeding within half an hour. So maximum mothers knew the commencement of weaning, and also majority of the mothers know the feeding of 1-year-old child. So this was maybe because UIP program. So lot of universal immunization program under that 100% immunization. So lot of mothers were coming in the institution for immunization. So that time this teaching is being given. So majority of the mothers do not know the sources of vitamin A, because vitamin A is important because vitamin A strengthens the respiratory mucosa. Okay. So that's why this question was asked. Okay, regarding immunization, so all the mothers feel child should be immunized, and majority of the mothers were of the opinion that child should be immunized with measles vaccine. Because there was a lot of resistance in 1989 here in Mumbai also, that mothers were not giving measles vaccine when it was come first time. Then caring the child during illness. So moderately high percent of the mothers give cold compress and tepid sponging when the child has fever. Okay, so majority of the mothers use home remedies for common cold and cough. Okay, so nearly all the mothers do not know to count the breathing of the under 5-year child. So more than 50% do not give plenty of fluids during cough and cold. So majority of the mothers don't give medication with the own decision, but some do give, and which is a harmful practice. Majority, that is high percent of the mothers, put oil in the ear and nose of the child more often in the ear. 45% of the mothers do not give adequate diet to the 1-year child. So the maximum children, now the practices, so maximum children were immunized completely, but 50% of the eligible children for vitamin A dose were not given because they didn't know its importance, so they did not give. Then 18% of the families in which someone from the family smoke. So this was for indoor pollution. This question was asked. So the information that they require, that was asked. So information need assessment for that. So moderately high percent of the mothers said they are confused, they are worried, they have tension and do not know what to do. So this shows that they need guidance. So majority of the mothers desired the information to be given to them should include caring the child during illness, care during fever, then what and how medicine to be given, and the diet that is to be given to the child. So these things were included while developing the manual. So in the second phase of the study, this was the different set of mothers. So this 60 samples. So majority of the mothers, they belong between the age group of 21 to 30 years. So they were quite young. So majority were Hindu families, and then maximum have primary level education. All the mothers were housewives except one mother who was doing the part-time job in the nursery. Then majority of the families had their family income 3,000 rupees to 5,000 per month. So this shows how in this was during 2002. Imagine what is their situation. So maximum lived in chawl system and few lived in jhopdas, hutment. Okay. So majority had joint family except group 1, where nuclear family trend was little more seen than the joint family among the 4 groups. So findings of the mother's knowledge regarding ARI. So knowledge of mothers regarding respiratory disease known to them showed that don't know response was from mild to moderate before intervention, whereas maximum mothers were able to tell 1 to 2 diseases. Then after the intervention, the mothers from the study group were able to tell more than 3 respiratory diseases. Then the knowledge regarding causes of respiratory disease showed that majority of them did not know before intervention. The factors responsible for ARI were assessed. All the groups before intervention did not know, but after intervention, the study group post-test score showed there was a significant difference. 50% mothers were able to tell 1 to 2 factors that were responsible for ARI among under 5-year children. the signs and symptoms of ARI known to mothers. The study group post-test scores were maximum. They were able to tell more than 3 to 4 signs and symptoms. The pre-test did not have any effect in the post-test scores in the control group. So this Solomon 4 group design is taken mainly whether just to find out whether the pre-test which is given to the control group, whether that influences the mothers to collect the information, and in the post-test without any intervention, whether the post-test score increases. So to find out that, this Solomon 4 group design was used. So my finding is that it did not make any difference.
Okay.
So none of the mothers knew that what is fast breathing in under 5-year children. So the post-test scores in the study group showed maximum increase than the pre-test scores. So all the mothers from the study group were able to tell about chest indrawing after the intervention. Then majority of the mothers from both study group and control group said that whistling sound is not a good sign in the under 5-year child. Then the knowledge regarding factor influencing caring the child during illness. So seeking medical help promptly is an important factor in the management of the child with ARI. So majority of the mothers knew 1 to 2 signs to seek medical help before intervention, whereas after intervention, majority were able to tell 3 to 4 signs, and some even told 5 to 6 signs. Then cleaning of blocked nose was not known by majority of the mothers. After intervention, all the mothers from the study group were able to tell the cleansing of the blocked nose.
Ma'am, one submission, ma'am. We can
Before
come to
intervention,
conclusion.
1 to 2. Yes, yes, sir.
Yeah, ma'am.
I'm almost.
Yeah, ma'am, please.
Yes, sir. So after intervention of the mothers knew about the immunization in prevention of ARI. Then opinion regarding SIM. SIM was easy to understand. The content clarity is good. Pictures were suitable to the content. They were attractive. Content of the SIM is adequate. Then all the mothers felt the SIM is useful for the mothers, and more than 50% mothers said SIM is very good. So analysis in this, we reject the null hypothesis by we conclude that the means of the post-test scores of 4 groups do not in fact differ. So that means the SIM has made a difference. So the difference between the study group and control group shows that the intervention of giving SIM to the mothers has improved the knowledge score of the mothers. You are able to see my screen, sir?
Yes. No, ma'am. No. We'll just.
No?
I have added a conclusion, ma'am. I think I have shared,
Yeah,
ma'am.
we
There
can
is a
see the
conclusion.
conclusion screen.
Yes, ma'am.
Yeah.
We are at the conclusion, ma'am. I have shared your slide only, ma'am.
Okay. So the conclusion is the post-test knowledge score difference is due to the SIM. So many studies have been documented that intervention brings about change in the knowledge. So therefore, educating mothers will improve the knowledge, mother's knowledge regarding caring the child with ARI. So for this study, the Dorothea Orem's nursing theory was used for the study. Thank you so much.
Thank you, ma'am. Thank you so much for your wonderful session, ma'am. Now I take a feedback by resource person. First of all, I would go with Dr. Sukhpal, ma'am.
I will say
Please,
Dr.
ma'am.
Pratibha, you have collected the data in the year of 2002, isn't it? You said?
Yes,
So
yes, ma'am.
22 years back, that time you said that lot of, still the domiciliary deliveries were taking place. And that time the TBAs were present. Traditional birth attendants were conducting the domiciliary delivery. It was only in 2008 when the government of India announced that 100% deliveries has to be there in the hospital by seeing the infant mortality rate, under 5 mortality rate, the maternal mortality rate. So it was made that, that 100% delivery has to be there in the hospital. Number two is that your sample size is too small and the findings cannot be generalized, Now a lot of things have improved, and now the incidence and prevalence rate of ARI and pneumonia has come down, if you really see, it has come down. So these studies, I don't think that you can go ahead for publishing this study. I think that is why it took you, because long back you collected the data.
Yes, ma'am. Yes, ma'am. So I don't intend to publish because now I know what it is. See, ma'am, when I became a student as a PhD from LT College of Nursing SNDT, my principal was not PhD. I didn't had any guide. I had to be given a doctor as a guide from KEM Hospital from PSNB department. And then 3 principals changed during my PhD study, and nobody guided. And now I understand. I am a PhD guide. I am a PhD now assessor. Now I understand. Of course, my study I'm not going to publish.
I know, Dr.
But it is
Pratibha,
already
you
there on
you
show.
can expand your study, to some extent. You can take new samples now, you can replicate your study and you can add some of the findings, now in your this previous study,
Yes,
Thank
ma'am.
you, ma'am.
That also
Absolutely,
you
ma'am.
can do.
Absolutely,
If you
ma'am.
really
Yeah,
want to
I have
publish it.
already. Yeah, I have replicated the same study twice separately, new data, and presented in international conference, and also
Okay.
published, and it is there on the ResearchGate.
Yes, ma'am.
Okay.
Thank you. Thank you.
Thank you, ma'am.
Sukhpal, ma'am, anything you wanted to add, ma'am?
Madam Bimla Kapoor wants to say something.
Ma'am, please, ma'am. Bimla, ma'am.
I just want to empathize with Pratibha because it is very painful when the guide is not there. And I'm so shocked that why SNDT did not permit you to take guide from outside Delhi. Number one. Number two is that 9 years is such a long period that she must have had a sleepless nights 9 years, It's no joke that your PhD you have submitted 2 years, the Viva is not planned and all that. So I can only empathize with you as a teacher, as a PhD, organizer and all. But I'm sure you are able to empathize with your student, which you are doing now. And I congratulate you for, and please engrave in the people also who are doing PhD that do not harass the students like that, Thank you so much.
Yeah.
But anyway, you have done the study
You
further.
have done it.
So it
Good
served the
job.
purpose. Congratulations.
Thank you, ma'am. Thank you so much.
Thank you, everyone. Thank you so much.
Sukhpal, ma'am, anything you want to add? Anu, ma'am, anything you want to, ma'am? Khanna, ma'am?
Very Sukhpal.
I called her, ma'am. Actually, she's not there. Sukhpal, ma'am, you are there, ma'am?
Let's go for the next one. Next presentation, if there's
Yes,
nobody.
ma'am. Yes, ma'am. Yes, thank you. Now I would like to call our second presenter, Professor Dr. Suresh R. Sir. Suresh Sir has a 17 plus years of professional experience in all the varieties of setting, currently working as a principal and professor at Rohi College of Nursing, Bangalore. And Sir is a member of various committees and a chairperson, and some addition to in his role worked as an observer person, LIC inspector at RGHS and Bangalore, and KNC inspector also. Sir has attended, participated in workshop, many conferences at local, state, national, and international levels. Sir has published many articles in referred journals, and Sir is a member of UCHERE, NSS, TNI, NTI. Now I invite Professor Dr. Suresh Sir for his research presentation. Over to you, sir. Suresh Sir.
Please unmute yourself, Dr. Suresh.
Yeah, done. Thank you
Yes,
so
sir.
much, Dr. Muthu, for your wonderful introduction
Thank you.
about me. And happy advance Diwali to all our nursing fraternity who all are here. And I am really very, very happy to being among one of you all nursing legend. And thank you so much. And good morning to all our nursing society scholar, patron, president, and chief guest, and honorable chief guest, and special guest. All good morning to all. And I want to confess in front of Dr. Bimla Kapoor. So when I was in 2001, when I was studying fourth year, UG fourth year, we had options of OBG and psychiatric. We chose boys, we chose psychiatric. So I was struggled in psychiatry. So that time my madam told you take Bimla Kapoor book and to start to read. So I started to read. That book was real. I purchased very simple, colorful, point wise, very nice. You know, that time I got a distinction in 8th semester. I got distinction because of your book and my teacher guidance. That I want to confess. So I have chance to share in front of you. Thank you so much for that. And in my PG also, I would like to take psychiatric only. But my wife forced me, you take medical surgical only. Then I choose medical surgical because of my wife. And in medical surgery, successfully I done, and everything is going smoothly. Thank you so much to all. Next, already given introduction about me. So next one more experience. I was in 2001-2. I worked 2-3. I worked in Apollo Hospital in Chennai. That as a emergency male nurse. So we have a chance to shift so many cardiac patients from home to hospital and hospital to other hospitals. There are so many, like in emergency, we have communicated with mostly emergency department and ICU department. So that time that emergency care was different from hospital to hospital, among doctors to doctors. That like I mean like some cardiac medications. Same medicine not administered in every hospitals. That I remember that when I have that PhD took, that time I tried to talk that take that same topic only. So that the topic only it's there. A study to assess the effectiveness of video assisted teaching program on knowledge regarding selected emergency pre-cardiac medications among staff nurses at selected hospital in Bangalore. So here, so you know very well, here I say about some variables. There is a variable dependent and independent. So can you show me that previous one, please? The previous one, title. Yeah. So here you title, please. Problem statement. Yeah, first one. Yeah. So here, variables. There is two variables are there. Knowledge is one of the variables, and video assisted teaching program is the variable. Knowledge is the dependent variable, and video assisted teaching program is the independent variables. So then apart from these demographic variables, that samples that the characteristics we taken. And there is 8 I given 10 characteristics, but our guide it's reduced to 8 characteristics of the individual staff nurses. Then questions, knowledge regarding knowledge, I prepared 50 questions. After all reduction, they gave finally 30 questions. Each questions that is general information, 6 questions. And regarding some 6 medicines, finally they selected and gave. One is clopidogrel, nitroglycerin, and aspirin, amiodarone, and morphine, and next oxygens. So these are the medicine, because in this my setting is hospital I mentioned in Bangalore, Janapriya Hospital. It's a 500 bedded hospital. They have 2 hospitals. One is 350, one is 150 bedded hospital. Their doctors also I discussed. They given this choice of medicine for the data collection. So according to the all guidance, I take 6 medicine because my title selected pre-cardiac medications. Amongst
Dear
hospitals,
Suresh, your PPT is not visible.
Ma'am, it
Only
is not
statement
visible.
is there. Yeah,
Now it
only
is visible.
statement. Yeah, after the statement, the PPT is not coming.
No, ma'am. Sir only told me to stop there only, ma'am. With that,
yeah,
he was
okay, no
explaining.
problem. So just I'm talking about final introduction about the
Yes, sir.
technical
You can go with the
emergency.
PPT, sir, please.
Yeah,
Okay,
it's okay because you should clear no information. No. So what are the
Sure, sir.
variables
Sure,
and
sir.
a questionnaire? How much 30 questionnaire I taken and
Please, sir.
8 variables. That's why I just
Please, sir.
taken.
Please,
Next,
sir.
I'll move to the
Please.
introduction. As I told you, because nurses, cardiovascular disease is the one of the leading global cause of death, like other disease, diabetes, mellitus, and cancer. So it is also one of the leading global cause of death, accounting for 17.3 million deaths per year, a number that is expected to grow to more than 23.6 million by 2030. Now we are in 2024. So there is the chance for increasing, expected rate of increasing into 17.3 to 23.6 million by 2030. So in India, it's 9 crore Indians suffer from heart disease, and 30% more are at high risk. So India already the diabetes capital of the world with 32 million persons with diabetes is projected to have 69.8 million in 2025. The count of hypertensive individuals is expected to rise from 118 million in 2000 to 214 million in 2025. So here nurses' role is most important in delivering cardiac emergency drugs in terms of proper dose, route, and side effect of particular drug. So in hospital setting, emergencies typically occur in emergency departments and intensive care units. Generally, the goal of nursing emergency drug is to prevent the patient from deteriorating to an arrest situations. So that's why here I clearly mentioned about the in introduction, nurses' role is very, very important to prevent from the cardiac some cardiovascular disease. Next. So need for the study. So these are some of the statistical measures supported for my studies. So coronary heart disease is now the leading cause of mortality worldwide and accounts for the death of 3.8 million men and 3.4 million women in each year. So during cardiovascular emergencies, the survival of the patient depends on a rapid response that provide high quality treatment based on latest guidelines. So administration of correct drug is an important aspect of this process, and among the health team members, nurses are taking an increasingly important role. So this mainly that the correct drugs is help like patients. Okay, so health team members will be an increase the important role. So it's very, very important. So these are the statements supported for my studies. Second, next.
Dr. Suresh, would you mind to come to the methodology and analysis? Give more time to that part.
Which one, ma'am?
I said you can come to the methodology and analysis and major findings of the study.
That's
and
okay.
give more time
Yeah,
to
he's
that.
there in the objective, ma'am.
Yes, okay.
You
Yeah. You just come to methodology chapter, Dr. Muthu.
Yes, sir.
So here, madam,
Yes,
then I taken here 4 objectives, 2 hypotheses. So objectives, you say about assess the level of knowledge and the effectiveness of the that video teaching process, effectiveness of video teaching, that multi approach and association with the knowledge and the demography variables. So these are the objectives I stated. Hypothesis also, just to go to methodology as per madam. Okay, so hypothesis also I have taken 2 hypotheses. So that is one is to the pretest, compare the pretest and post-test. Definitely after the video teaching program. So that is the knowledge level will be the knowledge level was improved. So that is also one of my research hypothesis. Okay, then second one is association also I did. That's a two hypotheses I taken. Next methodology chapter, I'll move to methodology chapter. So here it's a purely evaluative approach only, just assess the effectiveness of this video teaching program. So it's a evaluative approach. Research design, quasi experiment, there is no, it's not an experimental design, it's a quasi experimental because I just use the tool, that program only I used to enhance the knowledge of my sample nurses. So it is quasi experimental, one group pre-test and post-test design only. And here dependent variables and variables I already said, dependent variables and independent variables, demographic variables. So dependent variables, knowledge of the staff nurses will be depends the video assisted teaching program. So independent variables is the video assisted teaching program. Variables, I say 8 variables already I said you: age, sex, religion, educational status, and any experience, previous experience, and participated in in-service education and clinical experience. Like that, 8 variables I taken. So setting up the study, I conducted at New Janapriya Hospital. It is a 500 bed hospital. My sample size is 300. I taken 300 samples. So 300 samples includes staff nurses and interns who are working in our internship, 6 years internship. Their hospital who are working as a interns. I taken as a sample for my study. All my samples are cooperated for my studies. Enter my study, they were cooperated. Something is blocked. Dr. Muthu, something is blocked. It's okay.
Just see, sir. Is it visible, sir?
No, this right side something on block, totally blocked.
Oh, just a minute. Just a minute. Now is it visible, sir?
No. Yeah, it's now okay.
Yeah. Okay. Please.
Okay, so this all mainly I taken. 12 weeks I taken for my entire data collections, and here inclusion criteria. These are the criteria I used to choose my samples. The staff nurses and interns nurses working in selected hospital, that is Janapriya Hospital, like I said, and staff nurses who are willing at the time of data collection. Staff nurses who are willing to participate in the study only, as after consent only I choose them as my sample. Next, exclusion criteria. So, staffs who are not willing to participate in the study, staffs who are expected to be on leave during post test, and staff nurse who are already attended the pilot study. So they are the inclusion of my main studies. So here, just a description of my data collection. The self-administered questionnaire consisted 3 sections covering the following areas. Something block, it's blocking that all some square. Yeah. Okay. Now it's okay. So that is divided into 3 sections. The entire questionnaire consists of 3 sections. Only section A, B, and section C. Section A carry about the demographics variables of my samples, and section B is 30 questionnaire. It's assess the knowledge of the staff nurses. So regarding the selected emergency pre-cardiac medications. So 30 questions consist in the section B, and section C it consists of the video assisted teaching program. So here the score interpretation I given. So that is someone mistake is there. Because adequate knowledge 21 to 30 we given, so there is 25 is there. Moderate knowledge and inadequate knowledge. These are the my feedback should be so I arranged the score according to my questionnaire. So percentage also I given. Next pilot study also I did. So during pilot study, and I got my correlation value was 0.9. So as a result, the instrument was considered reliable for the main research. Okay. Next. So procedure for data collection. First of all, I got the written permission for my pilot study and as well as the main study also from the New Janapriya Hospitals Authority for the data collections. The data collection was done in the year 2022 as per the convenience of the respondents, and the purpose of the study was explained to them and informed consent was obtained from the respondents. The pre-test knowledge was found after the video assisted teaching program was conducted to them on the same day. Then after the period of 1 week, the post-test was conducted for the same samples. The data was collected for the period of 12 weeks. So first I conduct the pre-test. At the same day I given the video assisted teaching program also. After 1 week, I conduct the post-test. So this study was taken, 12 weeks I taken. And plan for data analysis here, descriptive. There's a two type of statistics. Everyone knows the two type of statistics. One is descriptive statistics and inferential statistics. For descriptive statistics, I used like frequency, mean, median, mode, and standard deviation. This and all, and this frequency distribution table, what are all like graphs, all used in the descriptive statistics. And inferential statistics, I mainly here test to find out the effectiveness of the tool, and like video assisted teaching program and association, that is high score test. I used to associate the knowledge and the demographic.
Suresh sir, one submission, sir. Can you go
It's
to
okay.
findings, sir? Directly we go to findings, sir?
Yeah, it's okay, no problem.
Yes, sir. I think these are the results, I think, right, sir?
Yeah, result. No issues. Binding also will go. We'll finish time.
Sure, sir.
Madam, feedback madam has to give.
Yes, sir.
Conclusions.
Yeah, result with this also.
Result. I have to read it from here.
Yes, sir. Yeah, please, sir.
Yeah.
We
So
can hear.
here, because one of my objectives is level of knowledge of the staff nurses. So in the free test, I got some so level of knowledge. In that, already I segregated inadequate knowledge, moderate knowledge, and adequate knowledge. So here, 193. Okay, 195 and 105. 195 samples are having inadequate knowledge about, that is around 65% of the sample. Inadequate knowledge about the questionnaire. So that range there, no less than 50% they got. So 195 samples got inadequate knowledge. Moderate knowledge 105, that is 35%. There is adequate knowledge. I didn't get any adequate knowledge of the staff nurse among the intern students. Next. So post-test adequate knowledge. So after the video assisted teaching program, I got sufficient. Here same opposite. So moderate knowledge 105, some 33% I got, and 195% samples of we got the post-test knowledge. Okay, so there is a adequate knowledge 195 samples, around 65%. Okay. So here effectiveness samples even, that is also that say about after the after the video assisted teaching program, I mentioned that like questionnaire wise I given here. Next. So here is about the association, because it is the one of the second hypothesis. First hypothesis, level of the pre-test and post-test level of knowledge, and second hypothesis is the association. So here the high score analysis revealed that there is a significant association between the post-test knowledge on selected emergency pre-cardiac medication among staff nurses with selected demographic variables like sex and participated in service education and income. So we got association between three variables, and there is no significant association with age, religion, education, department, and work experience. Hence, the statistical hypothesis rejected and the alternative hypothesis accepted. Hence, the research hypothesis H2 is accepted. So, conclusion, as I come to end of my presentation, the knowledge of the staff nurse regarding selected emergency pre-cardiac medication in the post-test was significantly higher than the pre-test. And the video assisted teaching program was found to be effective in increasing the knowledge of staff nurses So the third one, there was a significant association between the post-test knowledge on selected emergency pre-cardiac medications among staff nurses with selected demographic variables like sex, participated in service education and income. And its recommendation also given, so it's due to the limited study sample size, generalization cannot be made. Hence, a large sample search more than 300 also make it conducted on the same topic. The same study can be conducted over time with the frequent monitoring by the researcher. As an experimental design, the effect of video assisted teaching program on same pre-cardiac emergency drugs may be investigated. That's all my recommendations. And next reference also I given. Then finally, my studies published in these journals. Last year, this year only I published some journals. Also I attached. And thank you so much to all. And thank you so much to all, the madam, to give this opportunity to present in front of you all legends. Thank you.
Thank you, sir. Thank you, sir. Thank you so much for your elaborative
Thank you.
session. Now I go with the feedback. First of all, I go with the first Sukhpal ma'am. Dr. Sukhpal ma'am, you are there, ma'am?
Yeah, I'm here.
Yeah, please, ma'am.
Yeah,
Please,
thank
your
you so
feedback.
much. Thank you so much, Dr. Suresh, for presenting your research findings. I have two, three, just comments to make. One thing is, you have said that your approach was evaluative approach. There is no evaluative approach as such. Either it can be quantitative, qualitative, or mixed method research. Primarily, we categorize the approach under three main headings: qualitative, quantitative, or mixed method. And probably yours was quantitative. There is no evaluative approach. Okay. Secondly, about the inclusion criteria and the exclusion criteria. Once you are including something somewhere, exclusion criteria automatically will be there. These two are mutually exclusive. Okay? In inclusion, you have included the things. Then in exclusion, you are writing that you excluded those. Another very important aspect is you have included the interns and the staff nurses. We cannot compare. Interns are students. Staff nurses are staff nurses. They have varied level of experience. So as per the experience, we can correlate, subgroup analysis can be carried out, but we just cannot compare these two categories of nurses. And moreover, you have not as such discussed your knowledge, practices, or other things. What was the difference in the interns or the staff nurses? Nowhere we could see in your results. Another important thing is your pre-cardiac medication. Nowhere you have defined. What do you mean by pre-cardiac medications? Can you please just let us know?
Name of the medicine, madam?
You have written a pre-cardiac medication.
That is when the patients are coming with the complaint of chest pain. Okay, so that is some of the hospital maintaining their protocol to administer some medicines.
But as such, pre-cardiac medication, it is not the standardized terminology we use. I don't know how you have defined, and nowhere actually you have defined the things.
Okay,
so if you have just assessed the effectiveness of your intervention on certain drugs, you can specify the drugs.
Yeah.
But we couldn't see anywhere.
Pre-cardiac means, so it's mainly, that's why now protocols, they are maintaining some different emergency medicines for different hospitals. So all together,
you have to define that these were there are a number of cardiac drugs. You have to define that in your study you made use of these drugs, because probably it was your PhD level study, na?
Yes, ma'am.
At PhD we expect a lot, specifically your methodology, the kind of research design should be very, very strong.
Yes.
And your methodology should be very, very strong.
Okay.
Anna?
Yeah.
Yeah. So these are major things I just wanted to highlight in your study. But now, of course, it has already been done. Nothing much can be done. But in fact, in future, you will be guiding your MSc and the PhD students. We need to take care of these things.
Okay, ma'am.
And then analysis at PhD level, we need to have a detailed analysis. Inferential as descriptive as well as inferential statistics, subgroup analysis.
Yes, ma'am.
Maybe in short, but we should be, whenever we are presenting our research findings, it should be done in detail.
Okay.
ठीक
Thank
है?
you,
Thank you
Sukhpal
so
ma'am.
much.
Thank you.
so
Now
much.
I
Thank you.
call Dr. Anu ma'am for her
That the
feedback.
same,
Dr. Anu ma'am.
my during my Viva, Dr. Sukhpal
Yes.
during my Viva time, same question I raised from my evaluator, that is internship and staff nurses.
Mhm.
What you said, that question I asked.
Right.
I apology for that time.
But if you
But
have
they are final
maybe
year
received
students.
such comments, then you
Yeah.
would have done something else to show us.
Yeah, yeah.
Yes.
Yeah.
And separately, at least you can do the analysis separately for both,
Yeah.
just to see whether the interns were more intelligent or the nurses were more intelligent, and the level of experience the nurses had, and where
Yes,
is the posting. Number of things are there once we want to carry out subgroup analysis for the staff nurses.
Okay.
Okay, detail
Thank
can
you.
be done.
Thank you,
Yeah.
Thank
ma'am.
you so much. Thank you.
Thank you. Thank you. Sir.
Dr.
Anu ma'am.
Suresh, I would like to ask you one question. Can you show some of just one or two glimpses of your video instruction program which we have given?
Yeah, I have
And
photo.
who has done the validity and reliability of that video instructional, your tool?
Madam,
You
video-
developed the tool, no?
Madam,
You developed that video instructional tool.
Yeah,
And
yeah.
who?
It's a ma'am.
Somebody you
my-
have trained, you have developed, or somebody else has developed, or how it was, validity and reliability was obtained.
My video as a teaching program is excellent with music and attractive. So it is there in my folder. I have to find out that one. Okay, ma'am. And I attached all the photocopy in my thesis book also.
Mhm.
Sure, sir.
That all proof everything I done.
Yes, yes, sir. Yes, sir.
Now it's
Yes, thank you, sir. Yes,
give
thank you, sir.
some time. I will find out.
Sure, sir. Sure. Thank you. Thank you.
Thank
Anu ma'am.
Thank-
Anu Joykutti ma'am, you are there, ma'am?
Okay, let's
ma'am?
move.
Yes, ma'am.
Please, let's move.
Yes, ma'am.
Thank you so much for my suggestions. Thank you.
Suresh,
Thank you,
Suresh, sir.
Dr.
Thank you.
Suresh. Thank you.
Bimla ma'am, anything you want to add, ma'am?
Hello, I will just read the names and will
Yes, ma'am.
request Muttu sir, if Binu sir is not there, can you read the oath today?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
We have mixed of number of members, but very significant ones are there, and we are hoping on 24th of November we will have induction for them, but they are all welcome. The list has a small but good ones. Kiran Bala, Nav Kiran Kaur, Bhop Singh, Dr. Pratibha Chandekar, who just jumped into it and offered herself to be here, and I'm glad she did it. Then Mrs. Usha Rai, and then Anand Mukherjee, Shreya Nag, Dr. Arun Singh Chaudhary. So if Binu sir is there, he can read the oath, or if not, please read it.
Yes, ma'am. I solemnly pledge my allegiance to the society that I'll be abiding the rules and regulations of this honorable society. I will discharge my duties, bear the responsibilities as an office bearer. I will carry on my responsibility as life member. I will be a responsible member and not give any statement to media or in any groups which will reflect negatively on the society. I will function as a part of the society and not solo to promote my agenda or business. I pledge in front of Almighty and this general body to uphold the nursing professional standards and project the honorable image of my profession. I do.
I do.
I do.
I do.
I do.
Okay, next is thanks, I think. Go to next, please.
Yes, ma'am. Vote of thanks. Now I call our patron, ma'am, for vote of thanks. Over to you, ma'am.
Thank you. It's always hard to say goodbye when we all want to enjoy each other's company to the next possible time. But reality is different. We need to get back to our committed responsibilities. My sincere thanks to our chief guest, Sukhpal ji, resource person Anuji, guests of honor, and unfortunately Rita Lakhani ji couldn't be here due to illness of her mom and in ICU. Then special guests, especially I enjoy Dr. Ashia Qureshi ji, She is our, inspiration. Our lady, Iron Lady, Bimlaji, look at her smile and you will forget everything. Last but to our board,
Very good.
Masters of Ceremony, we have done marvelous and they have done marvelous job till now. And next also I will be expecting the same. And then PPT and other things you have done, Muthu sir. And to all of you, good morning. And to us, Ashaji and me, good
Good
night.
night.
And also happy Diwali to each one of you. We have three festivities. One is Diwali, lamps.
Bhaiya Dooj.
One is Annakut. You may be
Hello.
knowing